Hello and welcome to Midlands Today. The headlines tonight. An 81-year-old with suspected lung cancer distraught at having his surgery cancelled twice because of a hospital bed shortage.
I can't take much more. It is really affecting me now psychologically, and I'm not sleeping at night.
Stoke Hospital brings in temporary buildings to help cope with the pressures from patient numbers. Also tonight, the rural drivers getting squeezed at the pumps calls for the Competition Commission to take a close look at discrepancies in petrol prices.
The supermarkets offer constant deals to the customer and we cannot compete with these.
The desperate dog owner who's resorted to hiring a helicopter to help her find her missing pet. Hope for the future of football in Hereford. At least 3 groups interested in building on the history of Hereford United.
And although it appears calm for now, there's plenty going on under the surface that'll bring changes in the coming days, but they're largely to do with the temperatures. I'll have all the details in the forecast later.
Good evening. An 81-year-old who may have lung cancer is distraught after having his surgery cancelled twice. Ted Highfield from Cannock says he couldn't face the 60-mile round trip to Stoke-on-Trent again to be told there are no beds. Royal Stoke Hospital has apologised for what happened and today outlined the new buildings which should ease the pressure on surgery in the future. Here's our health correspondent, Michele Paduano.
Ted Highfield gets out of breath. He has a tumour on his lung. The former police officer and sports therapist from Cannock was in a gown in Royal Stoke Hospital with the area marked for surgery when he was first cancelled. And today, he was cancelled again. I'm
in poor health psychologically, physically, and it's enough to be getting on with without any further problems. I feel that I'm being let down, and I don't know how much more I can take.
Royal Stoke Hospital hopes this will help them off the hook. The hospital, which has one of the worst performing A&E departments in the country due to a lack of beds, is investing £13.5 million in portable buildings. When complete, they will provide an extra 56 orthopaedic beds and 2 theatres. Although this is to take patients from Stafford, the medical director says a building the size of a football pitch should ease the pressure.
We're going to be making a total of 112 beds available. That's more than enough to cover all of the Stafford work and will increase the capacity for surgery here at Stoke for the benefit of both people of Stoke and Stafford.
These former children's wards are also being renovated. They will house 56 patients needing emergency surgery. 28 will come on stream to coincide with the closure of emergency surgery in Stafford. In 2.5 weeks' time, any patient from Stafford who needs emergency surgery, that's anything from appendicitis through to a broken wrist that needs pinning through to major trauma, will be housed on this ward in Stoke-on-Trent. Ted is due to have his operation next week. The Royal Stoke Hospital has apologised, saying that it is currently experiencing the highest demand for healthcare in 10 years, and unfortunately that means cancelling some planned surgery. Ted just thinks it's a mess.
It's not only me. I've witnessed other people going through the same thing. They're exactly the same thing. It's in chaos. The NHS, in my opinion, is in chaos.
Well, Michele is in our Stoke studio for us this evening. So, Michele, is Mr Highfield right?
Well, the highly respected King's Fund today has said that the system is extremely stretched at the moment. In a sense, Mr Highfield is a symptom of what's actually going on because you've had all the pressure on A&E. Now that's going back through the system. So operations are being cancelled, and we understand a third more operations have been cancelled recently. That's going to lead to more people in the waiting list, and so the situation goes on.
And new A&E waiting times will be announced tomorrow. What are they likely to show?
Well, I expect them to actually show there's been a slight improvement because this is after Christmas and things started to get back to normal, but they're a week behind time. What we've got now, actually, this week is a very bad cold snap, and that affects people with heart problems, it affects people with lung conditions, and I suspect that at the moment it's getting worse again. Now, at the Royal Stoke Hospital, we've been told that there is a problem at the moment with norovirus, and they are still at internal emergency level 4, so I don't think things are going to get better anytime soon.
OK, Michele, thank you.